So, Prakash, I
Hi.
know that we met the other night when you tuned in to one of our other sessions.
Mhm.
Again, I'm Chrissy Alexander, and I'm the chair of the department at Metro. Um, the school health program was an outgrowth of the family medicine department, and I served as the medical director when we first started, when we did the pilots, and when we first grew the program before we were able to recruit another medical director. And I alluded to Katie, but Katie, would you like to introduce yourself?
Yeah, hi everyone. My name is Katie Davis. My background is in nursing. I have a master's degree in advanced public health nursing, and I currently serve as the program director of our school health program. So oversee a variety of our sites and all the little ins and outs, and then work really closely with our residents as well who come throughout our program.
Awesome. And Michael, you want to introduce yourself?
Sure. I'm a family medicine physician. I've been at Metro for 21 years, and I love education and working with our residents, also our medical students who come to visit. And school health is one of our community engagement programs that I absolutely love. Katie can tell you that whenever she sends out one of those things like, we need a preceptor, I'm like, let me figure out what I can do to get over to the school. Because
He's the first to respond, which makes me happy, but also he's the one I ask all the time.
Because I just love seeing those kids, and getting to see them in their environment in the school is really fun. It's just like a very special, different way. Maybe similar to the way a home visit is different than seeing somebody in your office. You know, you get to see them in their more relaxed, at ease space. So I love that, and I love all the different schools we do that in.
Awesome. So I'm going to go ahead and do the formal presentation. I can't see everybody on the screen, but for those that I do see on the screen, if you have a question and you want to just give me a little, hello sign, hi sign. Otherwise, you can also use the chat box. And if we haven't gotten to you, feel free to just unmute yourself and shout right out. Oh, I think I see Vanessa Mayer logging in. I think that you might be on mute, Vanessa. There we go. Would you like to say hi to the crew and introduce yourself? Oh, you're back on mute. So while she unmutes herself, Vanessa Mayer is the person, as I mentioned, I was kind of the early medical director for the program. And Vanessa was heavily recruited from another health system and had a longstanding interest in school health, actually, from the time that she was working on her MPH. Oh, there you go.
Can you hear me? Sorry.
I can hear you, but not really super loud, but I also couldn't hear Larry super loud. Can others hear her okay? Can I see any nods if y'all can hear her okay? Yeah?
I can hear.
Excellent. Okay, so it's just me. And there's Valentina. Hello, Valentina.
Hello.
Do you want to say hello to the crew?
Hello, everyone. Sorry, got on late. I was having some technical difficulties, but I'm one of the second-year residents at Metrohealth who have the lovely experience of working in the school health program. So I'm here to answer any questions if you guys have any.
Awesome.
And then
Fantastic. All right, so let's get rolling. So our school health program, I feel like it's always been there, and in reality, we really started developing the underpinnings about 10 years ago. The mission of the program is really to improve access to health care for our kids, the kids of our community. And we do this by partnering with the school system, partnering with other community stakeholders to advocate and support the health and well-being of our kids. and the values that we really focus on in taking care of these children are compassion, collaboration, innovation, and striving for excellence. What you see in this picture is our school health van, our mobile unit. And we have kind of a combination of in-school clinics where we actually have space in the clinic, and then otherwise in the mobile unit where we actually go into the school, take the kids out of class, bring them out onto the mobile unit, see them on the mobile unit, and then return them to class. So it really is a pretty efficient way to see the kids. A lot of the kids in our community, in order to be seen for an appointment, they often miss a full day of school because there's no transportation to school, like back and forth from school. It's like initially they'll get, the bus ride to school and then the bus ride home. But if they have to leave during the day for a doctor's appointment, there really is no way to easily pick them up and return them. A lot of the kids in the district walk. But that might mean that they walk a mile or two. So a parent who walks a mile to get the kid, walks back over, gets to the appointment. They're not really going to walk another mile back and forth and then do it again at the end of the day. So there are just lots of barriers like that to the kids getting care. A doctor's appointment equals the full day off of school, which the kids, I think, often love, but not the best for their educational experiences. So this is the day that we launched our very first clinic, and the reason I love this picture so much is just because the little girl with the braids was so hilarious. She was just awesome, and you'll see in the picture that to the left is Lisa Ramirez. She wasn't able to be with us on this call, but she's our director of behavioral health. And this really is a super collaborative model. I'm going to ask Katie to talk about it in a little bit, but we really believe very strongly in integrated, kind of co-located integrated behavioral health. And so we have a team of psychologists and behavioralists who work with us, not just in the school health program, but also in our primary care offices, our primary care continuity sites, but very, very heavily integrated into the school health program. So this is a picture of the very first clinic that we opened. We had our pilot there, and it was on one side of town. If you know anything about Cleveland, like there was this big east side, west side sort of thing. We're divided in half by the downtown and the lake. And so it's kind of like, people joke that you have to have, your passport to go from one side of town to the other. So this one we picked very purposefully. It's a pre-K through 8 building, and that was the very first pilot. And then the second pilot, which was the one that Katie Davis really launched and ran for us, was on the west side, very close to the main hospital, and that was a high school. And then we very quickly grew from there. So this gives you just a rough idea of the dates that, we launched in November of 2013. You might have heard me say that it's been around for 10 years, and it was really just because we were in the planning stages and seeking funding and building up our community resources and stakeholders, and that took the better part of several years to come to fruition. So that's the clinic that I mentioned to you, and in the meanwhile, between those two pilots, our hospital system hired a new CEO, and that CEO, during the interview process, when I met him, he just totally fell in love with this idea. So when he came on board, he was like, that's fine. I want at least, 10 more schools by the fall. And we were just like, whoa, whoa, whoa. And he's like, and I want 20 by the year after. And we were just like, okay, deep breaths, deep breaths, deep breaths, yoga, what's my calming words, was kind of the feeling at that time, but really happy to have that level of investment from our institution. Since then, we've really grown exponentially. Katie, do you want to say a few words about some of the expansion that we've undergone?
Yeah, definitely. So we did start with the Cleveland Metropolitan School District, which is the main urban district in Cleveland. They have over 106 schools. Since then, we have expanded to Positive Education Program, or PEP schools. Well, the interesting about PEP is that it's actually a community mental health agency that provides educational services. So this partner really works with individuals who have high needs, whether it's emotional or behavioral health needs. They have one whole center dedicated to individuals who have autism. They have 4 psychiatrists on staff. And so our team works really closely with them to really do that preventative care. We want to make sure they have physicals on file so that some of those students might have restraints, so they need to know if there's cardiac issues or anything like that. So we really do a lot of physical work with them. But we also partner really closely, Dr. Meyer, as well as our nurse practitioner, John Youssef, to work with a psychiatrist around lab work. So a lot of these individuals might be on psychiatric meds, and so they do want to follow different labs, but the doctors order them, but then nobody actually follows up with them. So by going right to the school, we're able to get them. So it's been a really unique partnership that has been excited. This past academic year, even though it was cut short, we expanded to another inner ring suburb of Cleveland, which was Dr. Meyer's actually alma mater. So now we're in Cleveland Heights University Heights School District, and we have an in-school clinic space there. It's been exciting to work with the district because they've prioritized giving us space in the high school, and it's one of our largest high schools. So that has been great to grow there. And then interestingly enough, also Metro has built a new ambulatory satellite on the west side of Cleveland in what we call the Ohio City neighborhood. And Urban Community School is an independent school, pre-K through 8. And it's a unique model. It's not typical to a school-based health center or our normal program, but we actually have a medical director over that school who does some standing orders. We have a school nurse, and we're really working right now to coordinate ways to have a whole child model where students will have physicals on file every year, immunizations, and some wellness programming. And then this fall, Dr. Ramirez has become the behavioral health director for Bay Village School District, where she's actually doing a lot of mental health consultation and some prevention programming. So we're looking at a lot of different models and ways to meet needs of students. I think the interesting thing to point out, majority of our districts prior to Bay Village are definitely urban, under-resourced communities. Bay Village is definitely a more affluent community, but there are definitely needs and gaps in care around that mental health area.
Thanks, Katie. So really what you see is a tremendous amount of growth. And I don't know if you all have had the opportunity to experience, or if any of you have had the opportunity to experience a school health program where you're training. But one of the things that we kind of, maybe joke isn't quite the right word, but maybe the common phrase is, if you've seen one school health program, you've seen one school health program, because there's just so much variation depending on what each community needs and who are the stakeholders that are involved. And so as we kind of evolved the program, we did a lot of work around, what does your individual community need? What does your individual school need? Even as Katie mentioned, the Cleveland Public School District, each of the schools that we serve, we do a needs assessment, because what is the need of one school, even within the same district, is very different than the needs of another school in that same district. So you'll see, even though we have a school health program, there's just so many variations of what we provide depending on that location and their individual needs. And so in addition to that, what I think is really unique, let me go back for one quick second if I can. The urban community school that Katie mentioned, we actually have one of our 2 resident continuity sites is now on the same campus as urban community school. So they were buying up all of this land around them. And so with the land that they had purchased right adjacent to the school is where we built a new continuity site. It's an entire building. Our main campus hospital, where we had a continuity site for our residents, is now relocated to that facility. So we really are on site, literally across the parking lot, like a little alleyway and parking lot from the school itself. So there's just a high degree of interaction with the kids of that school. Not right now with COVID, where we're trying to keep everybody separated, but that we are the medical provider to that school, and we are a collaborator and a partner to them. So, and Mike, you have your continuity clinic there. Do you want to just give, a minute on what that facility is like being on campus with a school right there?
Sure, it's great. I mean, the first time I went and saw the kids at Urban Community School, we used our mobile van. We have this really cool mobile van that has 2 exam rooms in it. And the kids would walk out of the school with one of the people from the office into our little van, and we'd do the exams in the van. Now, instead of a van, well, I guess in addition to having a van, we have this huge, beautiful new clinic. And once COVID is a little bit more under control, we're trying, I know Katie, you're working on doing some educational stuff because we were talking about it this morning about going to the school and building this whole educational program. I imagine us very much integrating right into the school, even more so than you've already done. But it's really, the whole program you guys have set up is really amazing because when these kids come, there's already been so much pre-work done that someone's already called, a nurse has already talked with grandma or whoever the caregiver is. We know what immunizations we're getting. Maybe we know something about behavioral issues that maybe came up before. So it's just a much more whole, and what do I want to say? It's not reactive. It's like you get in there ahead of the kid and you know what they're needing and you understand it a little bit more in the context of their family. So that's, sorry to blab about it. Our new clinic space is wonderful. It's very light and fun to be here too.
Awesome.
Yeah. I mean, Chrissy, can I echo real quick? I think
Sure.
a lot of those ideas that Dr. Reddick is talking about are some things that Dr. Meyer had brought in around really making population health a priority for our program. So Dr. Meyer worked really closely with our care coordinator to develop pre-visit phone calls. So if someone's coming out for a well child, we get all those informations that you would typically ask beforehand. So our residents sometimes make those calls as well if they're going to be in clinic and have that experience. And then we also do, in terms of that not being reactive, we have registries in place where anyone that's enrolled in our program, we're able to know who's due for a well child, who's behind on immunizations, do they have asthma? Dr. Meyer and our care coordinator get a list of someone in the emergency room so we can follow up. So it's really a different way of being proactive and doing that preventative population health care than just waiting for someone to call you.
Mm-hmm. Yeah, it really is so much of a better model. And in a second, I was going to ask Dr. Meyer to talk a little bit about population health, but also about some of what we're going to be doing with asthma in the future. I want to just mention real quick that not only do we go out to the schools, because of all of these partnerships, we've now developed a school on our campus. So the school where we had one of our original pilots, the high school that's very close by to the main hospital, now has a whole section of their school that is housed in our hospital. And it's just such an amazing program where they go to class here, they learn here, but there's also a work study component so that they can work in different areas of the hospital, get to know those areas of the hospital, kind of develop some mentoring relationships. And it's really meant to be a pipeline for these kids who come from very, very underserved areas, so that by, doing a couple of years of high school, and eventually, the plan is to have them on campus for all 4 years of high school, but to have at least several years of high school in a hospital really helps to take down a lot of barriers for them for seeking, careers, education, etc., but also for them to engage in their own healthcare. So it's a pretty powerful experience. And you see in the lower right-hand picture, one of the tunnels that, when the kids come to school, like first day of school, doing the clap in, and then at the end of school, doing the clap out. It's a really very emotional experience, I have found. So we view school health in many different ways. So just some pictures of the wonderful kids, and the staff that we have is unreal. It really is the dream team. Every single person that is part of school health is selected because of the unique skills that they bring, but also we've been just so blessed to have such great fit with each other, and the way in which our skills complement each other. It's really just been so amazing to be part of this. Like, I really can just pinch myself when I think back to 2010 and we first had this idea. Like, I just can't even believe that this program exists and it's expanded so much, and the numbers that we're getting, just in terms of things that we offer the kids, it's really striking. The data nationally suggests that you should have at least 70% of any school consented in order to have a successful program. We've not quite hit 70% consents in any of the schools that we're at, and yet the results we're getting in terms of who's had well child checks, who's up to date with their immunizations, who has an asthma action plan, all those sorts of things, we are blowing away the national average. So even in the setting where we shouldn't be, we are, and it's a testimony to the engagement of the community, but also the incredible team, the residents, just the whole picture. So I'm gonna ask Vanessa to chat just a little bit about that asthma project that we're doing. I think she.
Yeah, can you hear
There
me?
you go.
I'm so nervous about my microphone, you guys. I'm having so many technical challenges. So I am so excited to talk to you about the school health program, because I think it's a wonderful way for our students and our residents to learn population health, right? So, you guys are really getting your feet wet in value-based payment models. And so you're going to be the new future of doing population health in your practices, right? And you're going to have to be identifying who the population is that you're managing. You're going to have to be, really doing that, identifying the care gaps, developing the registries, doing the report generation, creating the care coordination frameworks. You guys are going to be doing population health management in your future careers, or you're not going to be able to make it in medicine, right? So these are really important skills, and so we're excited to be able to do this and really demonstrate value, not just for our healthcare system, but also for our educational partners. So it's been a wonderful, wonderful journey for our school health program, and I'm really excited to hear from some of you how you've been learning about population health in your training, and how you're learning how to interface with these really powerful informatics tools that we have. So right now we have in our school health program our registry of the students who are enrolled. The truly wonderful and powerful and exciting thing about our registry is that it interfaces with our school data. So we have a key identifier for each student that is their school ID within our registry. So we're able to look at both health and educational outcomes for our students, which is truly unique. So we've been able to partner with the research office within our educational partners, and have been able to build some infrastructure to do a little bit of research around how these sort of newer innovative models of delivering care within a school. So we do have a small NIH funded pilot looking at how we're doing asthma management in our school health program. So we are so blessed in school health. We have a very strong medical legal partnership. I'm excited to hear if any of you have worked with a medical legal partnership. So we are connecting our students when indicated to a medical legal partnership. We're developing a tool to identify which students should be connected to a medical legal partnership, as well as we're working with our environmental justice organization here in Cleveland, Environmental Health Watch. I'm interested to hear how others have integrated within the environmental justice space in their own communities. We're blessed in Cleveland to have Environmental Health Watch, which is our local environmental health justice organization. They do home inspections. So we're working on a specific tool that we've developed in partnership with them to identify students who would benefit from home inspection and remediation. So we do have a small NIH randomized control trial looking at that intervention to determine if our screener tools and then also these collaborative partnerships that we have, whether or not we're going to see either health or educational improvements. You know, one of the populations that we focus on in the school health program is our students with asthma. You know, we do have a group of students who are very, very high risk asthmatics, very severe asthmatics, and we know from prior research that if we can leverage in-school medication administration, we can reduce emergency room and PICU admissions. What we're also interested in is low-level asthmatics who are just missing school, but maybe not showing up in the emergency department. So how can we really optimize health for those students to ensure that we're improving their educational outcomes as well as helping to manage their asthma? So it's a pretty exciting model and really leverages some of the prior population health work that we have done with our registries, our care coordination frameworks, and then you know, being able to work closely with our educational partners on educational metrics as well as health metrics. So I could go on and on talking about, you know, how we're doing population health within the school health program. But
I don't know if you all can hear her. Can you?
I can hear her.
you can,
Is
okay.
anyone else not able to? Anyone else in the audience?
There we go.
Chrissy, were you
Yeah,
having a hard time hearing me?
So I lost you for about 30 seconds or so, but maybe it was just me because that happened earlier for me too. Did you all get to hear her? Just talk about, okay. It probably is just me, which would surprise no one who knows, like, you know, what little technology skill I have.
Well,
Awesome.
no, it wouldn't surprise me either because I know for a fact that my microphone is having challenges. So I do have the backup headset that I might pop on if it seems to be a problem. So please just shoot me a little chat message if you're missing out on something I'm saying or if I'm not making any sense whatsoever. So can I don't know how much time we have. These are mostly medical students or?
Yep.
Fantastic.
Yeah, so this is all medical students, and we have 2 questions that have popped up in the chat room. I'm going to go ahead and tackle them. And Val, I don't know if you want to share any of your experience because you get to go to school health a little bit as an intern. It's really more so during your 2nd and your 3rd year. But I don't know if you had anything, Val, you wanted to share.
So yeah, I did mine actually in like the March, April months. It was right around when COVID started. So I think we were only at I only was at one school. But one thing I would like to say is it's a different feel because when kids come to see you in the clinic, they're with their parents, they might have their siblings, there might be a bunch of things going on. But when you see them, I wasn't actually part of the mobile unit. We had a classroom that was reserved and we had little patient rooms in there. So it's more that the children are coming to see you and you're meeting them in their comfort zone. But then another thing is I think they thought they were just going to see the school nurse and then they end up seeing a resident. So, and then you get to talk to them. And like I said, they seem to just feel a lot more comfortable because you're at the school rather than at the doctor's appointment where they have a lot of anxiety. And you can obviously talk to them about their health problems. So I did see a person there with asthma. We gave a breathing treatment. Then we listened to them after the breathing treatment. They got better. She had her inhalers in her purse. I taught her how to use them because I don't think she was actually using them properly. And then I was able to sit down and go through the asthma action plan with her right there in person. And you don't feel that pressure of like, oh, do I have another patient waiting for me? You have all eyes on deck with them. And then it was also very helpful because I was able to talk to the mom before I saw her. And then, of course, after she left, I updated the mom. And so they're very, very appreciative of that, because this mom had actually known that her daughter was struggling with asthma. But as Dr. Alexander had brought up, in this case, it was more that she couldn't have her daughter stay at home because she didn't have anyone to watch her at home, or she would have to miss work. And she was worried about missing work. So essentially, if we weren't there in the school with the breathing treatment, who knows, like if the asthma would have gotten worse, if she would have ended up in the ED. And so the mom was very, very appreciative that we were able to help her daughter without her missing work. And then with the vaccines, something that was really cool about that is before I did school health, I'd actually volunteered a month or two before, where we had gone to the school during a school fair. And so the parents go for parent-teacher conferences, and then they also go to the school fair afterwards, and they're able to sign up their children. It's a waiver saying that if their child goes to the school nurse, that they can then be seen by a resident if need be. And the really cool thing about that is you only have to sign the paper once. So if the child's in kindergarten, that waiver is good until I think they're in 8th grade or high school. I can't remember. And so that's really nice that we're able to offer that, because sometimes, again, the parents can't take off work and bring the kids into the doctor's office. And then, so it was one thing, it was nice that we're able to see them there at their home base. And then also able to do physicals and give vaccines. So even though somebody had come in just for abdominal pain, I'd seen that they were due for some vaccines. So I was able to call the mom and say, hey, I saw your child here for abdominal pain. Their vaccines are due within the next 30 days. Since they're here, we do have the vaccines available. She's like, oh yes, please do it, please do it. And since she had already signed that waiver a couple years ago, we were able to give the vaccines. Of course, I double checked before giving anyway, but so that's just nice to see them at their home base. It takes a lot of relief off the parents, and I think the kids just in general feel a lot more comfortable that you're there at their school versus, the tension of being in a clinic sometimes.
Yep. Awesome. So we have a couple questions coming in.
Oh, okay.
So,
Let me see. Sorry. Oh.
No, that's perfect. So we have, Larry has a question about HPAC. I don't know how many students are familiar with HPAC, or if any of the students are here from Neomed. So HPAC is called the Health Professions Affinity Community, and it's a way of working with underserved communities and kids who are part of underrepresented minorities to learn about how to assess their community, do a community intervention, and then assess the intervention. And it was linked to one of the local medical schools, Northeast Ohio Medical University, but then has transferred over to Case Western Reserve University. And in some of those transitions, the ideal was for us to partner with the HPACs in our school health program so that students who wanted to be part of an HPAC could get connected and could work on a project. And that ended up not working quite as smoothly as we hoped, just because of some of the transitions that the HPAC program itself went through in moving from one, university to another. But we do have AmeriCorps, which is a whole nother program that puts people into schools to help work with the kids in underrepresented communities. And some of them did end up doing HPAC work. So that's Larry's question. But we have another question about, do you have children from the school health program who continue to come to see residents and attendings as adult patients? And so I have a great story about this. I don't know if anybody else has a story about this, but really from the pilot that was at that one elementary school, there was one young boy who came in and saw me for something fairly random, and then his mom hadn't signed a consent, and then he came back in because the dog bit him, and so we were cleaning up the wound and blah blah blah, and through that I was like, I really need your mom to kind of sign the permission form, and he shared that the mom was illiterate. And so we were actually able to help get mom connected to services to learn how to read. But then we also saw that kiddo as he left and then went to high school. So we were able to kind of connect him, and then his brother started at the elementary school. So there was this really wonderful thread that happened, and he now is in the military, but we did kind of continue to see him, although he did transfer his care then to one of our continuity sites as well. So the program hasn't been around long enough to fully see a lot of these kids as adult patients, but the whole idea is that we really want to make this part of the medical home, so that's where a lot of these, the schools that we serve are in relatively close proximity to a Metrohealth site, so that we can kind of connect them back to a home base. The other thing, and Katie, I don't know if you want to share this a little bit about the data around how many different schools the kids go to, like how the transfer rate.
Yeah, no, definitely. So definitely echo one to what Dr. Alexander says. All of our school health sites are within a 2-mile radius of a Metrohealth facility. So if we aren't there, they do have access and also access to specialty care as well. We're also even working on telehealth for that. But I do think kind of some of the transiency we see, and some of this is due to social determinants of health, such as transportation, such as housing and eviction. It could be due to foster care or kinship issues as well, or kinship challenges. So within our, at least Cleveland Metropolitan School District, 1 in 3 students will transfer in and out of a different building for any of those above reasons. Some of it could also be behavioral issues or challenges of just working with leadership. So that's just within the district. And then 1 in 5 will transfer in and out of the district to inner ring suburb schools. And so hopping in and out of districts. So that's a lot of just change for those individuals. And so for us, being able to see students at any of our sites and have that one-time consent that was mentioned a little bit earlier is really beneficial to have that continuity of care. And even if they stay in a neighborhood, our care coordinator will do some follow-up to connect them to services even if they're no longer at the school.
Mm-hmm. Yeah, you can imagine how challenging it is for these kids that, they go to at least 2 schools a year. So just thinking about educationally, right? You start in one school, you're going to end in a different school. Like it really is overwhelming. So we have a question from Carolyn, a 4th-year student from Charleston, one of my favorite places on earth. We have family down there. Have you worked with legal partnerships to benefit immigrants, particularly Hispanic patients? If so, how does that work in your program? Vanessa, do you feel like your technology is good to take a crack at talking about the legal partnership and how we use that for patients like this?
I'm going to try it. Oh, is it working?
Yep.
Oh, thank goodness. Okay. So yeah, it really is. I don't know if anyone has had an opportunity to be in a clinical space with a medical legal partnership, but it is truly extraordinary. We do have a lawyer who has assigned to the school health program who has helped us with numerous things. And I didn't train in a space that had a medical legal partnership, so I was unaware of all of the ways that we can interface with our legal partners. And you're absolutely correct. Katie can probably talk about some of the specifics around legalities of those who have been victims. So for instance, I was not aware that if you are an illegal immigrant, if you have been the victim of a crime in this country, you have specific legal rights and protections that are afforded to you, even if you are an illegal immigrant. So, the laws are complicated, and I'm a physician, I am not a lawyer, but we do have this amazing power of a lawyer who can have significant impact on the health outcomes of our patients. And I'm sure all of you may have examples from your own clinics of, how just getting access to basic legal services for your patients has had tremendous it has increased your ability to care for your patients. So we certainly see that with our asthma patients, for families who are working with landlords who are struggling to get some specific work being done in the homes. We've seen our medical legal partnership be incredibly powerful for those who are working under eviction notices. I was also in the school health program. We often will leverage our medical legal partnership for certain disability requirements that the schools are required to offer for students. So you've probably had some training in terms of interfacing with schools from a health perspective. So of course 504s and IEPs, these individual education plans, and 504 protections for your students, for your patients who have, we use it often for our asthmatic patients who are missing school and should have legal protections so that they don't miss out on education because of missing school. So that's been incredibly helpful for us to be able to have the medical legal partnership help us with getting the services that our families and our students are legally able to obtain either through local governments or through our school districts. So yeah, we have a wonderful Hispanic population here in Cleveland, and it's been amazing to be able to fully integrate and interface with those communities in really exciting ways. So we have a very strong Spanish speaking component to our team. We have a number of bilingual team members. Sadly, I am not one of them, but Cleveland is such a joy to practice in because we have these very, very diverse populations that we care for, and it's a pretty exciting space.
Yeah, and I will echo, yes, in terms of anything with both immigrants and any population, I would say our legal aid is amazing to work and partner with, and they do a really great job if it is an issue that they might not be able to address due to kind of what the contract and partnership looks like. They do a really great job of doing referrals as well. They've also done some support for some custody issues and things of that nature. So, and if not, they are able to find individuals access to referrals. And I will just also echo that MUSC has a really great telehealth school health program. So I can't see everyone's faces, but if you have not learned about that program while you're still in school there, you should ask about it because they have a really great school health telehealth program, one of the best actually in the country. So in terms of the school-based health services, they're very well known as a model. So just want to let you know while you're still studying, something to ask. And I'm reading the next question, Christy, if you don't mind if I tackle the immunization.
So I'm really having a hard time hearing everything, but I'm watching you guys talk and it seems like it's really good. But I think you were talking, did you say tackle the next question?
Immunizations. So there was a question about any issues with parents who are against immunizing their children. How do you communicate their wishes? Can you inform them properly? So a couple different things that we do in this regard. So one, our consent that goes out, and again, it's a one-time consent. The parents actually are allowed to circle any services they don't want. So if they don't want immunizations, they can do that. If they only want certain immunizations, there's actually a separate immunization section that allows them to circle anything they don't want. And we actually do provide education on what is required for school versus what is recommended. So obviously like your HPV, your meningitis B, your flu are not required for school. So they have that option to opt out there. We also, on that consent, there's a link to immunize.org, which actually has all the vaccine information sheets. So every time you give a vaccination, you do have to provide that education to parents. So we have worked with our legal that link allows them access to all of those VISs prior. So we do a really good job. Our care coordinator also We'll call them prior to visits, especially for a well child, just to review that you already approved these. Are you okay with it? She even will, especially if we've given them immunizations on an annual basis. She doesn't always make that call, but especially if they've never had a flu shot before and they didn't circle something, because sometimes people just fill out forms and sign them, but it's not like they're reading everything. So we do want to make sure that they are okay. So she does check with them. And then they also get a VIS form, an actual printed copy when they have that immunization to go home to the parents. So parents do get a copy of our after visit summary that is printed out in the backpack. And then if parents choose to, they can opt on to MyChart, which is our electronic health record system where they can see that information as well and can communicate to our providers. I will say the one thing that's been really exciting for us to see around immunizations is that, especially for our required immunizations, majority of our students are up to date, but for HPV, which one of the national goals right now is to have 80% of individuals have HPV series completion. A lot of states and areas are really sitting in that 40%. It's really because it's a series immunization, even with some of the new recommendations on having a 2-shot, people can't close that gap. I'm working on finishing our annual report, and so our students were at 82% completion of HPV, so we're really proud of that. And so some of this proactive stuff really does make a difference.
So I don't know if you guys can hear me okay, but I was going to direct our attention to that. Oh, thank you, Val, for the thumbs up. So the next question comes from Finn, and he's saying he noticed the community medicine curriculum, and could we elaborate a little bit more about that and the school health part of that? So Michael, do you want to kind of take a crack at that? And Val, then if you have anything to add to whatever Michael shares?
Sure, thanks.
Great.
Yeah, we're really interested in getting outside of the hospital and getting our residents and medical students who work with it and our faculty to engage in the community. And we have the support of the head of our hospital in doing that. So during residency, you'll do, if you come here, you do several months of what's called community medicine, where you engage in several different vulnerable communities outside of the hospital. School health started out as a part of that, and it was so, Katie and others grew it so well, it's its own separate thing. We don't even consider it part of community health because it's got its own package separate. But community health still includes several pieces that I'll just touch on. One is our work in the jail, so going to take care of people who are incarcerated, and then when they're released from the jail, helping them transition back into receiving medical care, because that's often a really big issue and often results in a cycle of recidivism and re-incarceration if people don't get help with housing and medical care and jobs and things like that. Another part of community health is the docs on the street, going out to take care of patients who have home or housing insecurity, and trying to meet them where they need the help, whether it's in the churches we work at, or in other, sometimes it's right out on the street in different places. Another part of community health is taking care of patients with serious mental health issues. So we've collaborated and joined with a community mental health organization that takes care of patients with more serious mental health problems, like patients who have schizophrenia. And they often have wraparound services where nurses might go out to their house, make sure they're getting their medicines, helping them follow up on visits. And our residents will go, and our students can go out there and take care of those patients where they are. So those are just a few of the things. There are lots of other places that we're involved in. During COVID, Chrissy helped spearhead this whole thing with taking care of patients who were at homeless shelters too. Then we have Renee Jones, which is a community organization that helps for human trafficking. So there's a whole bunch of different components, but I'll be actually talking about that more during FMEC if you're interested about community health, and it's a great thing to get involved with.
I know you wanted to see if I had any other info, but I actually haven't done my community medicine elective yet, so I don't have much info, but I can say that I worked for the DOTS program, which was an amazing experience. And then for me, my experience through school health was actually part of our pediatric outpatient block. So I did it through my intern year where we do our PEDS Rapid, which is Peds Urgent Care. in the outpatient setting, and a couple of days a week we go to the school for school health. But I am excited that we got the jail back for community medicine. I think that started this week. So yeah, sorry I didn't do that elective yet.
It looks like the next question was around any mentorship opportunities that allow medical students and residents to mentor patients with school health, especially those that are interested in going into medicine. I think that's a really great idea. While we haven't done a formal mentorship program, some of the things that we have done though is that some of our residents have gone out to do different talks at schools. So there is opportunities we've done, for example, sometimes with their younger students, teddy bear clinics, where they actually go and they teach individuals, they read a book to students, and then they show them they give all the students teddy bears, and they show them how to do a shot, and they practice, so they kind of build those relationships with the younger students. Some of our medical students and residents have also gone out in the past and done some just health talks, so talking about different topics like puberty or healthier relationships or nutrition. They've done those with both students and parents. We have had some career day talks, so people have gone out for both the younger students and the high school students to have those career day talks. So I think there's definitely opportunity to grow that. So it is not only the clinical services, but it's also the opportunity to go into the schools to do education. For example, we're also really excited that we're going to be working with our urban community school, with Ohio City Health Center. We're actually going to have some activity. The name is not yet determined, but I'm just going to call it Wellness Wednesday for now. And it's actually going to be community talks for residents, as well as urban community teachers can do just fun activities with the community. So we have a resident that likes to dance. So she might do something where she's going to talk about healthy movement, but then lead a salsa class. So we're finding different ways for the residents to get involved with the community in that idea, but I like the idea about the mentorship area as well. And I think sometimes those conversations also happen just in your physical. So if you're at a high school site, you might be able to do that mentorship there. And because oftentimes these residents come back to a site, they'll have that opportunity to engage with them.
Yeah, that's what I was going to say, Katie. We do it all the time informally. We can't help ourselves. We're like, wouldn't you like to be a doctor? We need doctors like you. We need people. Come on, think about it. Well, what's involved in that, you know? So yeah, we start pitching it right from an early age.
And there's a lot of med students who do the DOTS program, the homeless program that we do on Fridays. There's a lot of students that come in who are interested in family medicine, especially through NeoMed. So I know that there's almost as many students, if not more, than residents that do come to our Friday homeless clinic that we do.
Yeah, you know, medical students are very eager to get their hands out there and really help. A lot of us went into this to help people, and it's very concrete if you can actually be helping somebody.
And it's a great way to learn how to do injections and listen to heart and lungs, stuff like that.
And I think too, with school health, just thinking about injections and immunizations and so forth, you know, with so much being embedded in the electronic medical record, I think it can be really challenging as a resident to learn the immunization schedule, to know how to do a catch-up schedule, to know how to do it, you know, like what immunization is intramuscular, what's sub-Q, you know, like all of those sorts of nuances that you really get exposed to in school health that really has been kind of taken out of your hands in some ways in the outpatient setting. And so you really learn those so well that it really equips you to be a better doctor when you are in the office and, you know, maybe your nurse doesn't know the immunization schedules, doesn't know what to do with a catch-up, doesn't know what to do with an immigrant child who's just come and you have no records. You know, like there's all of that nuance that happens. I know we just have a few minutes remaining. Does anybody have any other last-minute thoughts or questions? I see we have one more. Are sports physicals or community outreach through volunteering at sports events part of the program? And actually, sports physicals can be a huge part of the program. It's a wonderful port of entry for students because if their parents don't really know us, you know, if they have a PCP but they've fallen out of touch with them, And this is especially true for those kids getting to like that middle school age. You know, like you have immunizations that are required of you to get into school, and then you have the immunizations that are required in like 7th grade-ish, you know. But outside of those times when immunizations are required, those kids can really just fall out of touch with a doctor. And so a sports physical is a really super great way to get reconnected. And so we really do try to look at a sports physical as an opportunity, not just to talk about the reason they're there and the sport that they're playing, but are they due for a well-child check? Can we convert that into a well-child check and do a more complete assessment? Or do we just develop a relationship, do a quick sports physical, but if we find something, we get them back? Or we say, hey, you know, we did the sports physical because, you know, the coach wants you to play like tonight, and, you know, like how many times has that happened? And then let's get you back and let's do a complete, you know, assessment and get you caught up on your shots, you know. So yes, we do it. There are a number of us who've gone to the sports events for the schools that we cover. You just get super attached to these kids, you know, and so many of them, like the stories that you will hear at school health, like I truly, honest to God, thought I had seen and heard everything because I'd worked at the county hospital for, I don't know, 15 years or so when we started the program, and I thought I heard everything. And then I went to school health and I heard from the kids that couldn't even get access to us. And so you will hear things that never before did you think you were going to hear about, like how you hide in the closet, you know, when shots are being fired in your neighborhood, how if you, you know, fall asleep, when your 16-year-old brother is making dinner, you miss dinner, nobody saves you a portion because there's only so many portions, so everybody else gets more and you get none. Kids that, you know, asked for food from Santa Claus for their gift for Christmas. Like you're going to hear things you've never heard before, and so you really, like, it tugs at your heart, and you will develop relationships that will touch you in ways you can't imagine. And so, you know, we really do go and you know, love supporting the kids. We even had one that, you know, our school won the championship, you know. So it's just, it's exciting. It's exciting to be part of their lives. And you like feel like a rock star walking down the hallway, you know, going to the clinic where kids want to walk up to you and give you a hug, and, you know, they feel a sense of connection.
Yeah, I would just echo that I mean, our providers definitely can volunteer. And I also will just say our sports medicine program at Metrohealth does serve as athletic trainers for some of our sites. And have those partnerships and with different schools, so they're able to be out there. So we have trainers at the schools and sometimes sports medicine docs as well. And we can do great referrals, especially for concussion clinics and things like that. And that sports physical is a great way to get people to sign a consent and get into our program. And echoing what Chris says, so the relationships that we build, whether it's going to the basketball game, and sometimes you go to the basketball game because then you get to meet a parent because they might not come to something else if they go to the sport event. We have individuals that have gone to graduations. You know, we had a college student, we had a student who just graduated. He found out, you know, that he got a scholarship this summer for college. He wasn't going because he didn't have a scholarship. He needed a physical. He couldn't get one because he didn't have a car. And so our team went out there and did the well child for the most part because they knew him at a telehealth visit, but then they went and met him in the parking lot and gave him his shots and was like, here you go. So, I mean, it is those connections that you build that you're not going to see somewhere else because it is community medicine. You get to build those relationships on a different level because you're not always waiting every 20 minutes for the next person to come in, although we do worry about productivity. Well, I do, just from a financial standpoint. You get to have those relationships and go to those different events to see things. And then the opportunity to set up community outreach programs or educational seminars if they feel there's a gap. Any resident that would like to set up anything to help our students, we always say yes to. Dr. Meyer is always also looking for anyone that's interested in research or any QI projects that you have to do. So people definitely, we are open to that. A lot of our schools always love having someone that can come in and have health topics. So if there's something you see, we can definitely always talk to the school nurse or the school leadership, and they're always open for those things, whether it's for the students or for families. So some of the other things we've done clothing drives, for example. We give out clothing. Again, you see things that you might not see in a clinic where we see that they don't have socks on when they come in, and we can give them that. We see them in their uniform shirt because they only have two, and so we can give them new uniforms. We've done book drives and things like that. So every kid that comes out has a book drive, and some of that has been helped by residents collecting things. So there's definitely different ways, whether it's at the school or other initiatives, to get involved.
And and just to also mention, like we have given away underwear because a lot of these kids don't have underwear. So we did underwear drives and give away underwear. And our one medical assistant, when she goes to weigh kids and they take off, you know, this is how we realized they either didn't have socks or had really bad socks. And she would like put them in a little warm foot bath and clean their feet and give them a nice, you know, clean pair of socks to wear. It's just amazing what the staff will do for the kids and how special, you know, it's like going to a day at the spa when Carolina was there because she was going to get out the warm pan of water, you know. So, yeah, we really try to do all that we can.
And it's also been interesting, I think, just something for especially our high school students. Sometimes we get to find out if they are pregnant and we get to welcome their child too. And so they're the ones sending pictures of their child after it's born to our entire team because, you know, we were able to be there for them and have the conversation with their parents that they were about to become a parent. So, I mean, we get to have those conversations too and kind of build those relationships differently.
Dr. Alexander, I need to bring things to closure. Thank you to your team at Metrohealth, and thank you to the students who joined. Everybody have a good evening.
Thanks, everybody. This was great chatting with you.
Thank you. Nice chatting with everybody.
Thanks. Have a great rest of the conference, everyone.
Bye.